Welcome, everybody. It's morning here in Sarasota, Florida. We're delighted to have you join us for our second day of the systems response to COVID-19, focusing specifically on low and middle income countries. Day one focused on large systemic issues and such as devices and factories and distribution. Today, we're looking at the clinical engineering and technology support and solutions around the globe. And we have excellent speakers from many points in the globe. We are, for some of them, it's still the middle of the night. We're very fortunate to have all of them join us. I will be moderating and co-moderating with Dr. Vieira, and we'll be introducing the speakers as we go. Cesar, welcome.
Welcome to this second day. It's great to be here with this great group of speakers. We'll try to keep track of all of your questions. We please ask you to save them to the end, or start sending them through the Q&A. And let's see if we run this smoothly and we can get this important message out to everyone. Back to you, Dr. Sloan.
Excellent. We are pleased to have our friend and colleague, Dr. Yadin David, offer some welcoming remarks. Yadin?
Elliot and Cesar, thank you very much. I'm delighted and excited to join today's faculty with my co-presenter, Ed White from the Wellcome Trust, and to welcome all of you to the second installment of this webinar series focusing on oxygen and challenges and solution. You know, the world have challenges. However, COVID-19 have made them higher and wider, unfortunately. However, as international community, we have learned that through collaboration between scientists, engineers, regulators, and supply chain experts, innovation can come up and solution can be applied. And we can come up with things like vaccine in a speed unimagined before. Medical oxygen, a basic gas that our tissues require for normal metabolism and to support life, is critically depleted now, especially in low and middle resource countries around the world. So again, like with the vaccine, let's find a way to collaborate, to implement solutions. And today's webinar is about those solutions. It's about how few success stories made a difference, how small steps towards wider oxygen production and delivery have actually met the target. Clinical engineers, biomedical engineers, and technicians are seeking the education you are offering today, are looking to be more engaged and become a partner to the solution. And that is what the webinar about today. We, from yesterday, understand the challenges and the methodology we need to take in collaborating. Now we are talking about the conditions and the application and the solution that are brought to you by engineers from Asia, Africa, and the Caribbean. So I'm delighted to welcome you and looking forward, like you, to hear the rest of the presentation. Thank you, Elliot.
And now, thank you, Yadin. And now I believe we have a recording. Is that correct? From the Wellcome Trust.
Hi, my name is Ed Whiting. I'm the Director of Strategy at the Wellcome Trust.
May need to turn your mics up.
I'm co-chair of the ACT-A Oxygen Task Force with my colleagues in Unit 8. Thank you to Dr. David for convening today. I'm here just to say a few words about the task force that we put together and what we're trying to do, and mainly also to welcome you to the session today, which I hope is helpful and useful, and to thank you for your time that you put aside on this really critical issue that is with us absolutely every day at the minute in so many countries around the world. Briefly to explain my organisation, I work for the Wellcome Trust. Our mission is to support science to solve urgent health challenges facing everyone. And at the minute, there are few greater health challenges than the COVID pandemic and the emergence of new variants and the day-to-day sort of challenges that many health systems are seeing. So we're delighted to be part of the work to sort of create a global solution and an ecosystem that provides oxygen solutions where they are needed, and to support partners across the global multilateral community to do so. So the gap that we see every day is in both the production of medical oxygen, but also getting it to the place that it is needed, and providing sustainable solutions in the provision of global oxygen, particularly in addressing surges that we see, around us every day as the COVID pandemic continues around the world. And in terms of what we're trying to do as a task force, we have a number of areas where we think as a group of organizations, we can support each other. One of those is supporting the technical cooperation to ensure that proposals come through at a country level that are made to multilateral funders like the Global Fund to fight TB, malaria and AIDS, to, for instance, the World Bank as well. And also I know UNICEF are playing a leading role here as well. And part of our work is to make sure there's that technical support to countries to put together those proposals, to make sure that they're asking for tools and asking for kit that will really help them. It's also to look at the market as a whole and to try and make sure that we can help the whole marketplace of global suppliers of oxygen to get that oxygen to where it's needed. And I want to sort of pass on my thanks at the start of this webinar, both to you, but also to my partners around the table for sort of stepping up, for doing work to put money aside to support this global oxygen response. The Global Fund, their C19RM process that they put in place is dispersing money in a fast-track window and is really making a difference today. Also like to thank my colleagues at the WHO who have been working to coordinate suppliers and to coordinate providers of finance and providers of support in the oxygen work. And they are really key in all of this work to ensure that the various parties around the table can come together and solve this problem. I also want to be clear that biomedical engineering resources in low and middle income countries are a key part of delivering those solutions. This is the way that we get those commodities embedded into health systems so that they can work today, but also provide critical capacity to support the response to other diseases in low and middle income countries over a much longer period too. So that biomedical engineering support, clinical engineers, really critical in that sort of making everything fit together and really embedding oxygen in health systems so that those provisions can reach the bedside. These webinars will highlight the collaborative work and also sort of some best practice solutions from engineers working on this issue around low and middle income countries. And I'm really excited about the group that will be talking to you today, speakers who've worked on this issue for some time. And I say, I hope that this can help to facilitate a global response to this problem that both helps us to meet this surge in demand that we're seeing today, but also create infrastructure and solutions that can endure for longer, so we can help provide resilience to other diseases and other sort of healthcare needs where they are so desperately needed. So thank you again, and I hope that you find the webinar informative and practical, and it gives you sort of support in the vital work that you're doing.
Excellent. Unfortunately, the volume was low, but when the recording is placed on our Facebook individually, perhaps you can listen to it more clearly.